So the BELLINI is a phase 2 window of opportunity trial where we treat patients with early stage triple negative breast cancer, meaning that they didn't receive any therapy when they are enrolled in the trial. So we looked whether or not patients that have early triple negative breast cancer can reach immune activations when they receive Nivolumab or Nivo and Ipi for 4 weeks before the start of chemotherapy or surgery. So it was a purely a translational endpoint to see what the potential of immunotherapy is in this patient population. So we so far enrolled 31 patients that we presented here at ESMO. We're also enrolling more patients in more cohorts because it's a basket trial, so we can open more cohorts during the time of the trial. So so far we're enrolling more patients. Yeah. So far we have found that if we give 4 weeks of a neoadjuvant immunotherapy without chemotherapy, that approximately half of the patients can reach an immune activation, so doubling of CD8 T cells or interferon gamma. And that was also the endpoint of the trial. So we wanted to see 1/3 of immune activation. That was the primary endpoint. And we see it in half of the patients. So, so far so good. So what can we do? I think what we can do with this information is to look better if all patients that are currently having early triple negative breast cancer need both immunotherapy and chemotherapy, because that's the standard of care. And I think it's a great step forward for all patients, but also it's not really precision medicine, right? Because now we treat all the patients at the same, in the same manner. And I think we believe there is a subgroup of triple negative breast cancer patients that probably don't need both of these therapies. Either they don't need immunotherapy because they won't respond, or maybe they don't need chemotherapy because immunotherapy is enough for these patients. Yeah, that would be great. I think if we can upfront identify these patients and in the future we can say, well, you probably only need chemotherapy, you need immunotherapy, you need both, or maybe you don't even need therapy, because if you have a highly immunogenic tumor, maybe you don't even need systemic therapy to have an excellent prognosis. I think that would be great for the future if we can start selecting patients for the right systemic therapy. Yeah.